We want to welcome everyone to our information session on the School of Physical Therapy here at MCPHS. The number is increasing there, so I'll wait just one more minute before we get started for any latecomers. Okay, so I want to welcome everyone again to our School of Physical Therapy virtual information session here at Massachusetts College of Pharmacy and Health Sciences. Please take note that this webinar will be recorded. And so if you miss anything or happen to step away from your computer and would like a recorded, the recording for this webinar, just email me and I will definitely be more than happy to send that your way. So my name is Tammy Trainer, and I serve as an assistant director of admission for the School of Physical Therapy. So we're super excited today because we're joined by one of the best of our faculty, as well as the best of the best from our students and our DPT program. So we're going to let them introduce themselves at this time. Let's start with Dr. Lachowski. If you can tell us a little bit about who you are and all that wonderful information.
Well, Tammy's always good for an ego boost for all of us on this meeting. As she said, I'm Steve Lachowski. I'm an associate professor within the Doctor of Physical Therapy program. I've been with MCPHS for over 10 years. I started as an adjunct, and then I became full-time faculty in 2016. I have an orthopedic clinical specialization. I'm finishing up my PhD in physical therapy, hopefully in the next couple months. And I teach in the musculoskeletal patient management series, clinical kinesiology, and clinical imaging. So I think that's all I teach. And if I forgot anything, I'm sure the guys will remind me too.
Excellent. And we are joined by three of our stellar students here at our Doctor of Physical Therapy program. We'll start with Greg and work our way down. Just let us know who you are, how long you've been in the DPT program, and I don't know if you're related to anyone famous or anything special you want us to know about yourselves.
Cool, yeah. Not related to anyone famous, so I'll start off with that. My name is Greg Aldrich. I'm a second-year PT student. I did my undergrad at Sacred Heart University in exercise science, and now I'm here, no complaints.
All
I'm
right.
Arthur DeMora. I'm a second-year physical therapy student as well. Undergrad was done at UMass Boston, also not related to anyone famous.
I'm Peter Petronzak. I'm also a second-year PT student. Did my undergrad at University of South Carolina, and I don't think I'm related to anyone famous.
No connections.
No, all right. Well, neither am I, but that's okay. We're still very important. So I want to let everyone know that we're definitely pleased to be here with you to discuss all things physical therapy at MCPHS. So during this session, we will talk about, of course, our university, the program structure, how to apply, and much more. If you have questions during this session, we ask that you place them in the Q&A section at the bottom of your screen. You'll see a little box with a question mark, and we'll be sure to answer all of your questions at the end of the presentation. So let's get started. All right, so these are some fun facts about healthcare and MCPHS. So healthcare is a great field to pursue at this time. Not only is healthcare one of the largest employers in the United States, but with an aging population, job openings are projected to increase over the next decade or so. MCPHS is a healthcare-specific university offering 100 programs in different healthcare fields. So healthcare is definitely our specialty. All right. Many of our faculty have clinical sites where they have affiliation, which means that we are always up to date on the current healthcare system. And additionally, all of our students are working towards some type of healthcare profession. We've been around for quite some time. The university recently celebrated its 200th anniversary. We started out as a small pharmacy school in Boston and have now grown to over 7,500 plus students between our Boston, Worcester, and Manchester, New Hampshire campuses, plus our online branch. Finally, MCPHS prides itself on maintaining clinical affiliations with some of the leading medical institutions in the nation, and we will definitely review a few of our clinical sites later in the presentation. So why MCPHS? So we're definitely proud to hold the #1 spot for a university when it comes to earning power. MCPHS reached the top of the Wall Street Journal Times Higher Education College Rankings list, surpassing the University of Colorado, Denver, Georgetown University, as well as Harvard University. MCPHS graduates are trained for high-paying careers in high-demand fields. So at MCPHS, we believe the true value of a college education is what your degree does for you after graduation, which is why we are proud to prepare students for exciting and fulfilling careers in the health sciences. We empower our graduates to take advantage of the exponential growth of the healthcare industry, where 1 in 3 new jobs will be created through 2026, according to the United States Bureau of Labor Statistics. So I want to reach out to our student admission ambassadors. If each of you can tell us why you chose MCPHS. We'll start with Peter and work our way down.
So I chose MCPHS for the DPT program because of how early we get into clinical experiences. By our 3rd week in, we're usually already working with patients at some level or going out to different places in the community and learning from licensed therapists there. So being able to get that hands-on early experience in addition to all the coursework was a huge plus for me.
For me, I'd kind of piggyback off what Pete said. It's kind of a similar reason as to why I chose MCPHS. Also, for me, it's very local to kind of where I'm from, so I'm able to kind of go home and kind of come back and forth on the weekends and stuff. So that's why I chose MCPHS. Also, kind of working with closely with the admissions team, like Tammy, kind of helped me realize how much of a family like kind of this environment is. So that's why I also kind of helped pick MCP.
I would love to like say something different, but honestly, like the main reason that I went as well is because of that early clinical experience. Like Pete said, we get into it like week 3 or 4 since you start the program, and it's good to like get in that early and start getting your hands on in some situations where they might be able to get you out of your comfort zone. You learn your best when you're out of your comfort zone. So we get like nudged out of it a little bit early on. And I think that's really beneficial for our early learning in this program. And it's also like a good distance from home, like an hour and a half from Connecticut home. So
Yeah.
I would also say like the structure of the coursework in the order we go through courses and how that's structured throughout the curriculum, that's another huge plus because it's very organized and helps you build a really solid foundation first. And then when you go into your clinical experiences or go on your full-time clinicals, you already had all your coursework and everything you need to know at the base level for all of that.
Excellent, excellent. Thank you all so much for sharing that. I always like to get your perspective as to why you chose MCPHS. Excellent. All right, so MCPHS does offer housing on a graduate level. Housing is available here in the Worcester campus. We have competitive pricing compared to housing in the Worcester area. Rates are located on our website, and prices include utilities and units come furnished. We have all different types of housing, so you can choose what type of environment you would like to live in. There are high quality amenities such as a new operational fitness center, cafes, computer labs, as well as study spaces, all in close proximity to the residences and classrooms. So I encourage you to definitely come to campus and take a campus tour and take a look at what we offer as far as housing. And then if you want to take a look at some of the apartments that are within walking distance, we do have a YouTube channel that you can just go to YouTube and put in MCPHS housing in Worcester, and you'll be able to see those options as well. All right, so I want to go back to our student workers, admission counselors. Sorry, we changed the names so often, it's hard to keep up. Our current student admission ambassadors. Yes, sorry for that. Tell me a little bit about housing, before we get into our IPE. Have you enjoyed living on campus, and do you feel that it has allowed you the opportunity to further connect with other students, living in this community? We'll start with Arthur this time.
Yeah, I mean, I definitely say I've enjoyed like living on campus. I got lucky enough to be randomly paired with Greg, who's also here for admission stuff. So since we're in the same program, it was kind of easy to like bond and kind of go to class. So you kind of already have like a built-in friend in that sense. Also kind of coming from like a commuter school like UMass Boston, I'd never got the opportunity to dorm. So kind of being able to go late nights and study as much as I can, and then come back later, like, or a couple of like hours later if we need to, or kind of just go home and it's like a 5-10 minute walk away. So kind of living on campus has been very convenient, I would say, is probably the best way to
I'd,
describe it.
I'd build off that too, just the convenience of it. Even in undergrad, I lived like at school as well, so I can't attest to the commuting part that you had before, but all of the locations we have are within like a 5 to 10 minute walk. We're in like the good side of Worcester. I mean, Worcester's a relatively safe city, but we're definitely on the good side of it. So there's never like danger walking back from class or whatever. There's parking options at every housing unit, which is super beneficial. And I think that like the fact that I think the biggest thing for me is that all the payments go straight into your like tuition, and you don't have to make like monthly payments like you would with a landlord, and you have to like worry about utilities and all that stuff. That's just put into your payments for the semester. So it's a lot easier than that sense.
Yeah, I would agree because the payments are also much cheaper than any of the off-campus housing you'll find around here. Um, like just base rent wise, and also everything comes included with it, utilities, electric, water, anything you could think of, and it's very close to the campus, so it makes it so much easier not having to worry about that, so we could just focus on our coursework.
That's great, great. Thank you so much for sharing that. So let's go into our next slide, which is talking about interprofessional education, otherwise known as IPE. So here at MCPHS, we give students the experiences of learning how to collaborate and work together with students and faculty from different disciplines, schools, and campuses. At least once per semester, students will participate in what's called interprofessional education, IPE activities. So I just would need one of you to volunteer and explain to our participants what is IPE, and share with us something that you've learned in the process.
So with the interprofessional education, we've had a few of these already. Our first one was more of just learning all about the other programs, what they're responsible for, what we're responsible for, and how we communicate with each other. We've also had other ones where we've collaborated with specific programs like OT, pharmacy, or acupuncture, and learned how we would collaborate on a case together, or different ways that they would treat from us. So it's great to see a whole different perspective of how some people might treat the same thing, as well as getting that early like experiences in collaborating with the other professions to see how it'll actually be in the real world practices we have.
All right, thank you so much. I know that it is a rewarding experience, and I know Dr. Lachowski is going to talk a little bit more about that specifically. And speaking of which, the man of the hour, the man, the myth, the legend, Dr. Lachowski. We're going to turn the slides over to, uh-oh. Maybe I pumped him up a little too much. It looks like we kind of lost Dr. Lachowski there. Hopefully he'll be joining us. I think he may have pressed something. So in talking about the program philosophy, everything centers around, of course, you being a successful clinician. I mean, at the end of the day, that is our ultimate goal. And so you want to have a curriculum that is contemporary. And I mentioned that earlier about some of our faculty being adjunct faculty, and they bring back to us what is being discussed or the equipment or anything that's being used currently in the healthcare field. And we're always updating our curriculum because healthcare is always changing and morphing. And so we want to make sure that our curriculum meets the needs of patients. Of course, there's a clinical application to our program as well. We have our integrated clinical experiences with hopefully Dr. Lachowski will return back to our webinar to explain a little bit more. Informed self-reflection, as well as a community of learning. And admission ambassadors, if you guys want to jump in and help me out here, since you all are currently in the program, anything you want to add, please feel free to do so. But all of these areas we are going to cover in the next slides. And so we'll talk a little bit more about each component of how this all comes together to make a successful clinician.
Yeah, I guess we can speak on the integrated clinical experiences since we go through so many of them like throughout the program. So essentially how these works is you'll go twice a week to like a different type of setting in the physical therapy space. So you'll have like outpatient, inpatient, like skilled nursing facilities. And then depending on the clinical that you're on, you might be responsible either one-on-one with a patient, or you might be two-on-one with a patient, or you might just be shadowing the physical therapist. But the good thing about these is that they're all under a licensed physical therapist. So a lot of people have probably heard about the BMW, which is something that MCPHS likes to talk about a lot. And that's essentially you kind of come in, you're with a second year and a first year student, and you guys kind of work together in a collaborative manner to kind of treat a patient. You're under licensed physical therapist there. So all the plans and treatment styles are all approved by the therapist. So you'll know you're given like the best type of care that you're able to do. And then if anything that they don't agree with, they'll let you know and you can make adjustments on there. But it really does, like, these integrated clinical experiences kind of help foster a like good sense of like what type of setting you kind of want to go into because you get exposed to them so early.
Okay, and this isn't talking about the third year where you're doing your independent clinicals. This is actually part of the first and second year, right? Where I think Greg mentioned it earlier too about being able to get your hands in it and getting that practice within like the first semester.
Yeah, we start at like I think it's the fourth week of the semester, third week semester. You'll have like a little practical type of thing very early on to make sure that you're comfortable with like vitals and guarding a patient, making sure that you can prevent like any falls or anything on any of these experiences. And then they send you off and you're able to get some like hands-on work in. So it's very beneficial for us.
Okay, all right, great. And thank you so much, gentlemen, for sharing that with us. All right, Dr. Lachowski.
Yes, how about that for timing and anticipation? Just as you're introducing me, Zoom decides to shut down. I was like, it's all theatrics, it's all the buildup, it was all planned.
I know. I kind of went through this, but if you want to go ahead and just start from.
Yeah, absolutely. So the way that we've designed our program that we're continuously trying to revamp based on student feedback, student outcomes, we have largely the same structure, but we're always trying to make improvements on the year previous. So some of the pillars that we really focus on with our program philosophy are an integrated curriculum. As our AT mentioned, we have an integrated curriculum with integrated clinicals. So what you're learning in didactic lecture and lab, where we align the clinical setting for you to go and see that and further supplement your learning with hands-on. I'm a hands-on learner, and that really helps stick once you actually see it in a clinical setting. We'll talk about the student support offered programmatically and at the university level. We'd mentioned the immediate experiential learning, and the IPE was already introduced, our interprofessional collaboration and education opportunities. And we have several opportunities focused on community service, as well as the ability to start having some exposure to research. When we look at what a successful clinician is, we've come up with these 5 attributes that help start to develop a successful entry-level clinician. And again, that's maintaining a contemporary curriculum, giving students the opportunity to apply that knowledge in a clinical setting through integrated clinical experiences. We have students become better learners by through self-reflection, identifying what went well, what went wrong, and those are structured and might be as simple as an exam review to see what went wrong, not just what questions did you get wrong, but what was the rationale, what was your thinking behind it. So then that way, when problems are encountered in the clinic, they can use those same strategies to find the best treatment options available for their patients. And again, a great opportunity within this program is the community learning that happens that ties all of this together.
Right.
So we had mentioned our the contemporary curriculum. So it's a 3-year, 8-semester, year-round program. Again, as mentioned earlier, those integrated clinicals begin the first semester. So about mid-September, I think, guys. I mean, correct me if I'm wrong, but usually mid-September, you hit the ground running after Labor Day, and by that 3rd week of September, you're off-site or in our Balanced Movement and Wellness pro bono clinic, interacting with patients, clients, participants. We start to teach early patient management through with assessment intervention skills. We have applied knowledge throughout different regionally specific courses. So musculoskeletal, neuromuscular, cardiopulmonary, pediatric, geriatric. All of those courses are taught by clinical specialists in that area. So I had mentioned I have my orthopedic clinical specialization. We have a neuromuscular specialist, cardiopulm and geriatric specialist, as well as peds and sports, which wasn't mentioned here. So all of the areas of current clinical practice are being taught to keep the content as contemporary as possible. And this concludes with your full-time clinical education in your 3rd year. So you have all of the knowledge that you need to then round off with 30 weeks of full-time clinicals to be able to develop who you're going to be as a clinician. We had mentioned one of the, or a couple of the different measures that we have for student support. Within the School of PT, every student that comes in is assigned a faculty coach. In undergrad, this might have been referred to as like an advisor. But again, we're trying to change more of the paradigm in terms of how we look at that, those interactions, that it's not just what you should do in class, but those coaches will serve as mentors for you as you develop your career goals and plans throughout the 3 years on campus. We have professional and peer tutors that are adjunct faculty, alumni, and then we have several students from the class ahead of you that will serve as the tutors. We have a new student support group called the Flocks. I'll let the guys speak to those because that's new and was created by this group, this class of students, which is just an awesome initiative that they took on. We have extensive adjunct faculty at all our integrated clinical sites. And then we're starting a new practice, summarized grading for growth. A lot of undergrad institutions, all the way from elementary through high school education, undergrad, is you get the question wrong, you get the points deducted, and then you get your score. We offer different opportunities that if there wasn't success on a certain assignment or practical examination, that you can go back, work with the faculty and one of these tutors or adjuncts to then strengthen the area where you were most weak and redo the assessment for an improved grade. Because again, we're here to support you and we want to see everyone succeed and graduate with their DPT. If one of the guys don't mind speaking real quick to the flock, since this was your cohort's idea, I think that would be amazing.
Yeah, so the Flocks, as Dr. Lachowski mentioned, it's kind of just a student support group. So any first year students will be paired with a certain amount of second year students, and you guys are kind of just in like a big group, which we call Flocks since the school mascot is a cardinal. And essentially, the second year students are kind of there to mentor, or answer any questions that the first year students might have, help like navigate certain challenges that you might find throughout kind of navigating grad school. So really, we're just kind of there for like student support. We found that a group setting would kind of work more beneficial than like a one-on-one setting, just because then you can kind of have built-in friends in a sense through your flock as well. That way, if you're struggling to like make friends, you can kind of have a couple people to lean on as well. That way, the transition could be as seamless as possible, hopefully, for grad school students.
Awesome. Thank you. And the fact that that was your initiative is even cooler. With the goals of our program is obviously to develop strong entry-level physical therapists, but to be able to practice, we need to all pass the national board exam. So our preparation starts early in your didactic training. Our course exams are all written in the National Physical Therapy Examination style. There are item writing courses that we've all taken to help identify how the boards will ask questions so that we can take that and implement those into our exams to begin your preparation from pretty much semester one. We've developed regular comprehensive exams that will occur once every year, staggered throughout, may occur in different semesters, but they are more comprehensive than most of the exams that are taking part in individual courses. This really starts to help build the endurance. The board exam is 250 questions, 5.5 hours. So not only is content an issue, but being able to sit for 5.5 hours and think critically takes a certain level of training. So we start to do that. We offer 3 to 4 full-length practice exams with subsequent question analysis. So it helps you, those analyses provide the rationale for the answers and can help you reflect on why you might have chose the answer that you did, why it was either correct or incorrect, and again, will help further develop your critical thinking skills. We provide a 15-week content review in the final semester prior to you taking the board exam. That usually will occur while you're on clinicals. It's self-paced. A faculty will oversee that just to ensure that the course is being completed. But we've had positive feedback on that in regards to the board prep. And then a ton of different available resources, including study apps, podcasts that we start to share early in the program to begin your preparation. With that being mostly at the programmatic school level, the MCPHS itself offers a wide range of support services. Academic support, so for CASE, Center for Academic Success and Enrichment, will offer peer mentoring, academic coaching, and various learning strategies. Our Office of Student Access and Accommodations works with students who may need extra time or specialty settings for taking exams. Our career preparation, we start to develop early on. We host an annual residency and fellowship panel for those interested in pursuing specialization following completion of the graduate degree. We host an annual career fair in one of our professional issues courses towards the end of your time in the program. The University Career Services offers professional resources to help with networking, as well as some of the basics, resume writing, interview skills, just to kind of build the most well-rounded applicant as you're entering the workforce, along with a variety of university counseling and resources to help you support you from the day you step on campus to the day you graduate. So our integrated clinical education, which was highlighted by our 3 here, is one of the main reasons that they came. And this is one of the hallmarks. Whenever I'm asked what's the strength of our program, I say curriculum and our early access to clinical experiences. So these occur through the fall and spring of your first year. There is a year 1 summer, but it is a very packed 10 weeks. So there really isn't much time for the integrated clinicals. And then in your second year, it occurs in the fall, spring, and summer as well. It can be a little daunting to students coming in, but it first starts as observation. We are realists. We understand what you're capable of, what you have the confidence for. So a lot of these experiences start as observation, and then you slowly wean your way onto practicing different clinical skills, whether that be the intake of vitals, guarding, transfers, and you'll slowly build into more application where you're delivering the care more directly. And again, it's in a staged and graded manner. So then that way, as your confidence and experience builds, we ask more of you in these clinical sites, but all the students feel ready. This is just a small sampling of our integrated clinical sites, as well as some of our sites that serve for full-time clinicals. So we have acute care settings such as St. Vincent's Hospital, UMass, Beth Israel, and we have subacute and rehab settings, which include Life Care Centers of America and the Northeast Rehab Hospital Network, and then a wide variety of outpatient settings. So Flaherty, Bay State, Elliott are some of the bigger names. We have had a lot of alum who have gone on to work for these sites and now serve as clinical instructors for our students. Our Balance Movement and Wellness Center is kind of the flagship of our integrated clinical education program. So it's an on-campus pro bono clinic that occurs within your integrated clinical education course. The second year students who are here right now are the primary PTs, I guess you could say, mentoring a first year student right now. So you are responsible as a pair for performing patient evaluations, designing and implementing plans of care, monitoring their progress towards goals that were established at the evaluations. And this is all overseen by 2 licensed PTs who serve as our adjunct faculty. They've been involved for several years, so they have a well-operating, well-oiled machine. And again, we have a long list of participants waiting to get in, which we could house more. But a lot of our clinical partners will refer patients who maybe maxed out an insurance benefit or have plateaued in their care, but would still benefit from direct supervision, having some continued skill care. And then we do see progress throughout the year with all the participants that come through this clinic, which is awesome. As you're progressing throughout the curriculum, there are different requirements that go along with the Balance Movement and Wellness Center as well. So right now in the first year, again, we have our 2s here that are going to be seen as more of the mentors, the ones directing care. Because again, the year 1 students are just, again, going through vitals, transfers, gait training, assistive device use, assistive device fitting. But then as the course progresses throughout therapeutic exercise and you have different developed different skill sets, you have different standards that are expected of you in the Balance Movement Wellness Center. And at the conclusion of your second year, our students present on a case study, which is their BMW participant that they've worked with throughout the fall and spring, that mark their initial evaluation findings, their discharge or their end of episode of care findings, and talking about the treatments that they utilize that may have played a significant role in achieving their goals and why the patients have progressed. One of the great things about being a health sciences only university is the collaboration that occurs within the different programs. So the simulation lab is actually housed within the School of Nursing, but we are fortunate to be able to have our students use it. So as you can see, it looks very much like an acute care or hospital setting, from all the equipment from bed, IV poles, all the different line management, everything that you may see in an acute care setting. It's a great way to take a very complex setting and make it manageable for students who might be a little bit nervous about going into a clinical rotation where they're going to be seeing newly post-op patients. And so not only are they used to not only are they trying to adapt to a full-time clinical schedule, but they're adapting to a completely different setting than the PT lab. So it's a great way for them to start to acclimate to this setting. And being an outpatient orthopedic guy, I can certainly appreciate the ability to kind of practice on healthy participants, healthy subjects, healthy partners. This is the place to make mistakes. So then that way, when you're actually in that acute care setting, the comfort level is much higher because you're familiar with all the equipment and just the setup, which allows you to focus more on patient care. Our interprofessional education is a collaborative learning event that occurs within the other disciplines of the university. Students are involved in multidisciplinary discussions focused on real-world issues such as cultural humility, opioid use. Our students participate in different community health screenings, fall awareness, prevention, dementia sensitivity training. The interprofessional education occurs at a university level with pretty much all programs involved, usually once every fall and spring semester, sometimes in the summer. And there are several smaller interprofessional education activities that occur sometimes within courses. I'll have one this year for the musculoskeletal course that I'm running with the three gentlemen here. We're working with acupuncture to do collaborative case management to show how the patient management model for PTs and acupuncturists overlap, and then how our treatments will could complement one another, and how patients would further benefit from kind of having a synergistic perspective where you have the PT view, the acupuncturist view, and how those collaborations could be beneficial to the patient. The students will have the chance to have acupuncture done to them if they want, and then we'll be demonstrating different treatment techniques for them too. So again, it occurs at the university level, but then also smaller course level activities too. We had mentioned community service. So our program is very tied within the greater Worcester community. We have the PT Service Club, which helps organize student-led service projects with different partnered organizations. So that might be a clothing drive, that might be a food drive come the holidays. Those are coming up in the next couple months. But then different events that students have brought to us for that they might be particularly passionate about, or that they've been involved with either family or at the undergraduate level. We also offer service opportunities that occur at a camp up in Maine, which is the top left image here, called Camp No Limits. It's a camp for children who've experienced limb loss and are now utilizing a prosthetic limb to carry out routine functions. So it's an opportunity for them to learn how to use the prosthesis, and also feel a lot more included with other children that are going through the same thing. So we have a small group of students that are usually selected to go up to that and get to participate in that camp. And again, that's an interprofessional activity too. There's nursing, occupational therapist, PT, various other healthcare settings that are helping these children adapt to kind of their new normal. And we had students organize an MS plane pull down at TF Green in Providence. So it's exactly what it looks like and what it sounds like. The more your group can tow a plane, I'm not too sure if that's a 737 or what, but the more money you can raise. And then we had a student led group organize one of the water tables at the Boston Marathon this past April, and then also in 2023. And we hope that continues to carry on into next year as well. And our research integration, we have varying levels of interest coming from each and every class. Some are really passionate, some are good to know that it exists and that we use it, and that's all. So our faculty try to provide different opportunities to engage students in research to whatever level they would like to be involved in. We've had students that have presented at university, regional, and national conferences. So our images here, we have a student scholarship showcase, which is that first image there, students presenting some of their work. We had a group of students 2 years ago. Dr. Joyce and I had a large group that did a study with blood flow restriction and individuals with cerebral palsy, and they presented their research in San Diego. And another group of now alumni who were screening the UMass Amherst baseball team preseason and postseason, tracking injury and trying to identify correlations between changes in strength, range of motion, and injury rates. And again, that is largely driven by the students' interests, trying to align with faculty who have the same interests. And again, usually a nice collaboration can occur there too. So the reason that we do all of this is for our outcomes, the reason that we've developed our philosophy, the reason that we have everything in place from the curriculum to our support is for our high retention, our high pass rate, and employment rates. We've had students go on to complete clinical residencies and fellowships. Several alumni are now independent business owners and have become leaders within the national physical therapy community. The longer we're around, the cooler it is to see, because graduates have now become clinical educators and adjunct faculty. So a lot of the CIs that we're sending students to are PTs who came through our program. So they're very familiar with my courses. They're familiar with what they were taught and how that they can approach everything. We have a number of adjuncts now, adjunct faculty who were students that graduated 2018, class of 2020, who are now involved in multiple courses and looking to make the transition into academia, and they're coming, back home basically to join us, which is a really cool full circle moment to see the impact that the school has had on them, their careers, and that they're looking to pay it forward.
Right. Thank you very much, Dr. Lachowski. That was excellent. So now we're moving into the admission part of our presentation. So all application materials need to be sent directly to PTCAS, which stands for Physical Therapy Centralized Application System. And so you will give them your official transcripts, letters of recommendation, your personal essay, any type of AP scores are sent to them. Do not send them to MCPHS. Prerequisites must earn a grade of C or higher, ideally higher. Science and math courses older than 10 years old from the designated start term will not be accepted. So for example, if you're applying for fall 2025, we can only accept science and math courses from 2015 on up. Letter grades of C- or lower will not be accepted. And the minimum overall science and math GPA considered is at a 3.0 on a 4.0 scale. If you are wanting to make sure that your international transcripts are sent to us appropriately, you want to make sure that you contact World Education Services for a course-by-course evaluation. Of course, that WES evaluation will still need to go to PTCAS as they handle all of the documentation. For letters of recommendation, definitely 2 are required, but we prefer to see 3 or more, with at least 1 being from a licensed physical therapist. And once we receive your application and we determine that your application it mimics a qualified applicant, then we will invite you to an interview. It is a virtual interview on Zoom, and it's just an opportunity for us to learn more about you and give you an opportunity to ask questions as well. So we are on rolling admissions, which means that you can get an admissions decision as early as a week or 2 after applying. The fall 2025 PTCAS applications are now open, and we are in full swing. Please remember to have a competitive application. We consider your cumulative GPA, which should be at least at a 3.0. We'd like to see a strong prerequisite GPA as well at a 3.0. Be sure to explain to us your interest, your experiences and motivation in your personal essays, as well as in your virtual interview. And we also feel that a campus visit also makes your application that much more competitive, because then in your interview, you can really talk to us about your thoughts on our labs, our facilities, and things of that nature. When it comes to financial aid upon admission, all candidates are considered for a merit-based scholarship of up to $7,000 a year based off of the overall GPA. Domestic students are also encouraged to complete the FAFSA, which is the free application for federal student aid. Affordability appointments are available to all accepted students. Your financial counselor is Lynn Berry, and he is available to discuss financing your education along with payment options. And below is his contact information, but if you are accepted, that information is automatically sent to you. So you don't feel like you have to write any of this down. And I definitely want to thank each of you for joining us this evening to discuss physical therapy at MCPHS. Before we move into the Q&A portion, I just want to let you know how you can reach me. If you are thinking of applying to our Doctor of Physical Therapy program, I encourage you to please email me with any questions, or if you want me to evaluate your unofficial transcript before applying, I can definitely do that to let you know what prerequisites you have already met, which prerequisites you will need to meet. If you want to schedule an appointment with me one-on-one through Zoom, this is the link that you can use to view my availability and to schedule an appointment. So you can take a picture of this, write it down, or what have you. But it looks like there are no questions in the Q&A. So we must have done a really great job of presenting this. All right. Well, if you don't have any questions, then I appreciate your time. And I want to definitely make sure that you take a look at our Instagram page. I believe this is our Instagram account. Go there and you can see us in action. Oh, a question has popped up. Yay. Okay, so this says to apply to the 3+3 program, you must apply